Dentistry is not expensive, your neglect is. Recently, we had a case which perfectly fits this statement. A patient came for a regular dental checkup. After the oral examination, we have diagnosed that the patient has all the grossly decayed teeth, especially his all upper and lower molars, which are used for chewing food. Since there was no pain, the patient felt that there is no necessity to consult a dentist. Now, the only treatment option we have is to extract all the grossly decayed teeth and then go for the replacement if the bone level is sufficient to place an implant. So today, let's talk how this tiny cavity may progress and eventually leads to this grossly decayed teeth. So initially what happens, the cavity will be a minor discoloration over the tooth and there won't be any pain. So the patient usually neglects it. Then this problem starts. So the cavity doesn't stop there. It will progress into the inner layers of the tooth, that is your enamel, then comes your dentin. Once the infection reaches the dentin, the patient might feel a bit sensitivity. It also depends on the individual. There might be sensitivity or there might not be sensitivity. At this stage, if the patient feels any kind of sensitivity, he starts using desensitizing agents, which is not the solution for the cavities. Eventually, the infection becomes chronic and it reaches the pulp. Then the actual problem starts. Even now, if the patient is not consulting their dentist for the treatment option, the infection keeps on going and innervating the inner pulp chambers and the complete old tooth structure will be lost. Then we really can't help even if he comes at that stage to our clinic. So the only treatment option we have is the extraction and then go for the replacement of the tooth. Replacement also, it depends on what stage the patient comes to the clinic. If the only tooth structure, the crown part of the structure is lost, then we can just remove, and if the bone level is sufficient, we can place an implant to replace that tooth. If the infection is left like that, there might be bone loss issue also, which may affect their replacement options with the implant. In that cases, we need to disturb the adjacent tooth which are otherwise healthy. We need to go for the root canals for the adjacent tooth. Then we need to place a bridge. The lesson learned from today's case is that whenever you see any discoloration or sensitivity issue or any kind of pain over the tooth, kindly consult your dentist as soon as possible to avoid the extraction of the teeth and also to avoid the major procedures which may cost you much later.